Scott Taylor, who's the moderator for this panel. And Scott, I'll just be real brief, his bio is in your folders, but let me just briefly introduce him. Scott's had a long history in the insurance industry here in Washington State. Scott joined Save the Life Insurance Company in 1971 as a group underwriter and became vice president of the group division. He was also senior vice president at Safeco Life Insurance, and he helped oversee the conversion of Safeco Life Insurance into Symetra Financial, which is a privately held corporation led by White Mountains Insurance Group and Berkshire Hathaway in 2003. Scott retired from Symetra Financial in 2008, and some of the activities that he's involved with, he's a member of the Health Insurance Association of America, as well as a board member of the Self-Insurance Institute of America. He's given numerous speeches around the country, served on many local boards, including KUOW, Public Radio here in Seattle, and he's also a member of our Washington Policy Center, Center for Healthcare Advisory Board. So we're thrilled to have two of our advisory board members as part of the conference. You heard Dr. Reggae moderate the first panel, and now Scott Taylor, another board member, is going to moderate this panel on the uninsured. Scott.
Thank you, Dan. Not to date myself, although there's any number of people since I retired last June who'll do that for me. But I was recalling the old tagline for a recording tape company, that is it real or is it Memorex? And I think that much of the discussion on healthcare issues is similar. Ergo, what is fact and what is fiction? Certainly the driving force of the healthcare debate is cost. It's the number of uninsured. But I think much of what the public is really hearing is more myth than fact. The operative number now of uninsured is 45 to 50 million. Recently I'm hearing 50 million, and quite frankly that number is a myth. The number of underinsured is 25 million. I tracked down an author of a national article who admitted he really couldn't define underinsured and just assumed they didn't have comprehensive health care. We've talked a lot about consumer-driven health care this morning. And I think, again, what is the impact? Has it lowered costs? Can indeed purchasers of health care make good economic decisions if they're given facts? So I think regardless of where you stand on the health care issue in the debate on reform, I think we all agree that it's best that we make some decisions based on fact, not myth. After all, we're talking about 17% of our GDP. And indeed, any change, or in fact, if we don't make much change, it's going to have long-lasting, significant impact not only on our economy, but obviously, indeed, upon the very fabric of our society and culture. So our two panelists are really going to look at the numbers behind the fact, particularly addressing the number of uninsured, or underinsured and uninsured.